When you're considering laboratory medicine or clinical pathology, there are a few main take-home points to think about when you're interpreting the samples that you have and the results that you get either from your in-house lab or from results that you get from external laboratories. One of the most important things to think about with your results is, you know what, the results that you get are only as good as the samples that you submit. There are really simple things that really help the laboratory and help you with interpretation. Simple things like making sure the samples are labelled correctly. Also, if you're sending samples that may be time sensitive, it's really handy to speak to the laboratory and find out the optimal way of getting the sample to them so that it arrives in the best state possible. That way you're most likely to get results that are representative of what's happening with your patient. Another important point is to consider the question that you're asking, especially if you're, for example, asking whether or not an animal has an infectious disease that are causing the clinical signs that you're seeing. Is it better to actually look for the pathogen within the animal, to do antigen testing or PCR? Or if you're screening an animal, is it in fact better to see if the animal has antibodies against that particular agent? In some cases, it makes more sense to see if there are things like antibodies that might show you that the animal has had exposure at some point, whereas in others, you really need to demonstrate the presence of the pathogen in the animal at that point in time to be confident that yes, this is likely to be causing the clinical signs that I'm seeing. Another point, especially with your in-house laboratory equipment, is to make sure that there is at least one person in the laboratory, one person in your practice, who understands what quality assurance and quality control programs you should be undertaking to make sure that your machines are measuring 1 as 1, 7 as 7, and 12 as 12. The manufacturers of the machine are usually very, very helpful in giving you guidelines as to how you should be interrogating your machines, how often, and what to do if you do have a result that doesn't make sense. On the subject of results that don't make sense, as a clinician, one of your most important jobs is to challenge results from the laboratory that don't fit the patient that you have in front of you. If it doesn't make sense, go back to the sample. Just make sure that everything is labelled correctly and you're genuinely looking at the right sample that goes with the right animal. After that, and especially if it's a result that you've had from an external laboratory, phone them. Clinical pathologists are generally very helpful and very friendly. And you know what? If it is genuinely an unexpected result, we're often happy to help with advice. It may be that you just have a very unusual case. I hope that this helps you with some of the major points to think about when you're looking at clinical pathology, and these are things that we'll cover in the courses to come. Thank you.